Hello, everyone. It's Robin here in Marrakesh during the International Conference of Urban Health. And I'm joined here by Sasha. Thank you so much for joining the bench to share more about your work and how we collectively, of course, can work on a good place. Um, yeah, just please introduce yourself and where are you from?
Okay. Hi, thanks. So my name is Sasha. I'm from Barcelona, from the Barcelona Institute for Global Health. And there we do research mostly in environmental health and trying to link how we plan our cities, with environmental exposure such as air pollution, noise, green space, and urban heat islands, and then eventually how that influences the health of the residents of those cities.
And this is global, not specifically Barcelona. What are the cities you're working on?
Yeah, so we have mostly a European focus for this. I've been working with a database of 1,000 European cities so far. And then we also look specifically at some specific cities like spread in different contexts in Europe. So Barcelona, of course, is one of our focus because we're based there. And there are a lot of interventions going on in Barcelona, but we also try to expand a bit. And now we are trying also to cover like different contexts in Europe, also from Western Europe, Northern Europe, but also Eastern European cities such as Warsaw. We have also Sofia in Bulgaria. So we try to do a bit of more detailed work in those kind of cities as well.
And what are the trending themes?
Zeb, sorry?
What's the trending theme or topic that you're working on? Is that air pollution?
So it's more like a combination because at the end at the end all those factors are interrelated. So for us it also doesn't make much sense to analyze them separately because all these exposures are very correlated and very much linked to how we design our city. So of course if you study air pollution, it's likely that there will also be noise in those settings where you have air pollution or less green space, more traffic, maybe more urban heat islands because you remove those green spaces. So at the end, we try to combine them all together and also link them to like urban interventions that try to redesign our spaces and kind of like reduce those adverse exposures and then promote health.
And are you mostly working on the research part side of things or also in charge of the interventions that you come up with?
It's mostly research. So yeah, we come mostly from the research perspective and a lot of quantification, so a lot of data analysis. So we actually, what we do is provide numbers. We say, okay, if like, for example, a city has a proposal and they say, okay, we want to put some green space here or maybe reduce traffic here. I don't know. All cities have different policies, especially like for air quality, transport and so on. So what we can do is just take the information from those policies and then quantify what that would mean for improvement of the environment, but also for health. So that's kind of where we come from.
And have you seen any improvements or developments that you, well, through research have seen over the years?
There is a lot of, I think, good examples. In Barcelona, we have a lot of that. It's very famous, the Superblock model. Many people have heard of it, and it's in Barcelona. It's quite easy to implement because we have like a squared configuration of the city, and it basically tries to close like the inner streets to traffic and then regain space for green space, but also for people to use to have a child play. So people can use again the streets and not to be in traffic all the time.
Yeah.
We also have this green corridor intervention, and it's a very good example. It's a main street in the Champlain district in the city center, and they have made it all pedestrian with a lot of greenery, and it's quite famous here for people to see. So those kind of are good examples.
We love the super block model. It's
Yeah.
great. Yeah, I think because it's becoming the main attraction for Barcelona for many people. And what do you after to find here during the conference?
I think I'm interested. Of course, we want to present what we're doing, but I'm also interested to hear from people from other contexts because we are very much focused on Europe, and in Europe it's kind of easy. You have different cities, but it's not. It's kind of easy to think of interventions, what could be changed. But I'm interested in hearing like about other contexts, what their issues are in urban health, and what kind of interventions they're doing there.
Yeah, I've already had conversations with someone from Ivory Coast on mosquitoes, to somebody from Bangladesh working on very much about heat waves. These are things, of course, that are not happening in Europe that much or at all. So it's interesting to learn from as well. Sasha, what is a good place to you?
Like a city.
Life, everything. And what would be your biggest mission or drive in the work that you do?
Well, I think at the end the goal is kind of, I mean, many things, but at the end it's kind of creating places where we have like healthy and happy people, and also thinking about the context in which we are, which is like climate change. We have degradation of our environment. So at the end goal is that we create living places that are healthy for people to be at, and where they can achieve everything they want. And for me, a good place is kind of, well, I guess it's a city where you can have everything kind of reachable. I mean, in which you can go out of your house, you can go shopping, you can go to the school to work, you don't need to use your car, maybe you have parks nearby, you have places where you can socialize, so kind of having this good mix of everything reachable, like very close from your home. I think that's for me like a good place to live.
Nice. And of course, that's also part. I like this theme, which is called, of course, a healthier horizon. So we're all working for that kind of positive dots on a thing. Do you also feel that health should become more tangible in daily life for citizens to experience, to be more conscious about it?
Yeah, and I think it's not something people think about. I mean, they can perceive, for example, I don't know, quality of life, maybe their stress levels, this kind of thing. I think it's more tangible to people. But when you talk about other things, such as, I don't know, like premature mortality or, I don't know, some kind of disease, people are not super aware of that, or they cannot link being like, okay, if I use my car, maybe I'm more sedentary, so that means I will have disease eventually. I don't think that's something people like think about, but mostly more about, yeah, like perceived stress or quality of life. I think these kind of things, they're more aware. Yeah.
Thank you so much for your time. Appreciated sharing your project and your dream with us. Have a wonderful conference and good luck with your session. And everyone watching, until the next one. Ciao.